Welcome to live Q&A with the experts of Rome Foundation. Today's session is titled GI Symptoms in Ukraine During Wartime, the Impact on Patient and Provider. I'm your host, Tanya Murphy, Executive Director of Rome Foundation, serving and educating in nonprofits and secondary schools and higher education throughout North Carolina. I'd like to introduce my co-host, Dr. Douglas Drossman. Dr. Drossman is the CEO and President Emeritus of the Rome Foundation, President of the Drossman Center of Education and the Practice of Biopsychosocial Care. Dr. Drossman is also Professor Emeritus of Medicine and Psychiatry at the University of North Carolina at Chapel Hill. He is the founder of the Rome Foundation and an internationally recognized scientist, clinician, and educator in DGBI and communication skills training. Today, Dr. Drossman and I are joined by Professor Oleg Shvets, MD, PhD, head of the Public Health and Nutrition Department of the National University of Life and Environmental Sciences of Ukraine. Professor Shvets is a member of the board of the Ukrainian Gastroenterological Association, president of the Association of Dietitians of Ukraine, and public health consultant of Ministry of Health of Ukraine. I thank you both for being here today, and I now turn things over to the esteemed Dr. Drossman. Thank you.
Thank you, Tanya, and welcome, Dr. Shvets. I feel I know you after our communication, so can I call you Oleg?
Thank you. Yes, of course.
Well, this is very important. I remember how we first got into this. I think you were communicating with me about some questions, and then I just thought of the idea how important it would be with the war going on, what it's like for you, for providers, and for patients. And that's the whole basis of our talk today, to inform our large community of providers and some patients about what it's like to be in that situation. I think you're one of the best people for us to talk to, since you're involved with the societies and are a provider like all of us. So again, thank you for doing this.
Thank you for having me. It's a big honor to represent the Ukrainian gastroenterology here.
Well, it's our pleasure. We have a few questions that we'd like to ask you that I think will be topical, and we can veer off the questions depending on where we go. But I think the first one, which is most important, is what is the current situation in Ukraine, and what are the difficulties that patients, physicians, and nurses are dealing with in this war?
Yes, in general, we have a tough situation. You could see it on TV from time to time. It certainly differs from one region of Ukraine to other. The closer to the front line, the more dangerous, difficult to live, or more or less peaceful life. And Ukrainians suffer from complex consequences of war. The real danger of being killed, forced relocation within country and abroad, some people losing their jobs and part of their income, shelling recently at night, most often, lack of electricity, water, heat, negative news, much more. So that the work of doctors also become much more difficult. And of course, this is like widespread that many doctors from Ukraine were forced to go abroad. Of course, mostly women, because they are worried about their kids. And also that the majority of gastroenterologists, psychologists, nurses, and other medical personnel are women. Thereof, we have shortage of workforce. And also the doctors experience everything the same that patients do. We cannot rest at night. Since the beginning of March, the Kyiv city, the capital of Ukraine, was shelled for 10 nights in a row. and it was from 1 p.m. to 1 a.m. to 6 a.m. every night. You know, that this is like very exhaustive, and people could not be like so full of energy and doing their work at high level. And also, you know, of course, that Eastern Ukraine suffers much more than Western part. And also we have some troubles in the healthcare system, many buildings destroyed, as well as infrastructure. And also we have lack of the funding. The entire country's budget goes to military needs, and the other programs mostly financed by international donors' assistance. And that, of course, the hardest situation with military patients and also people who in the occupied or region or captive, the possibilities are limited, extremely limited to help them, even via telemedicine.
You know, I'm thinking about the impact that you've described, which is huge, profound aside from injury, profound and death, psychological impact, post-traumatic stress, things of that. I think what makes it so difficult, even more difficult, is that it's not something that goes away in a week or two. We're talking 3 years. This is chronic, it's become a way of life. How have people adapted to this kind of everyday situation for 3 years?
You know, I don't know if it is possible to adapt because this is like changing every day. You have another problems. You need to go somewhere in more safe place, or you don't have like electricity. You should buy battery to keep the basic things running. So we're trying to adapt, but it's like almost impossible to fully adapt to this.
Well, then I think I'd like to move on, since we're talking GI as well. Have you noticed any changes related to DGBI, their incidence or prevalence during the years of the invasion? And are there any features related to the clinical manifestations and the frequency of patients seeking help? Or is there a place for them to seek help?
You know, we're still planning to study these changes, and especially on the national level. I can say only about my observations that I see in my patients at my practice. And they are more or less coincide with what my colleagues report. We notice an increase in the frequency of painful forms of DGBI, including functional dyspepsia, IBS, and their subtypes. We expected before a higher frequency of post-infectious IBS, functional diarrhea, but currently such a trend is not so obvious. Apparently for sure, psychosocial factors are the most powerful triggers. And they have a complex impact together with physical depletion in many people. Of course, many patients report a worse quality of their own diet. For example, many men left without a family, and they consume significantly more processed foods. In fact, the Ukrainian traditions are associated with the predominant consumption of home-cooked meals. Rarely people are going to the restaurant or buying ready-to-use food. We are cooking at home. Many things like soups, meat, fish, etc. Separate problem is the increase of alcohol consumption and the spread of smoking. Significant number of people who stopped smoking and drinking alcohol returned to it after Russian invasion. And we think the impact of these bad habits on the course of DGBI is worth studying more extensively. And if we talk about the frequency of visit for DGBI, I think that now it's about like 2/3 of outpatients visit to gastroenterologists, and I believe that many such patients also visit family doctors. And the growth is observing since 2022. I think like several percents per year, more or less.
You say you think it looks like that there's increased seeking of healthcare.
Yeah.
And I wasn't quite clear. Do you feel there's an increase in the incidence of IBS since the war?
Yes, the incidence, and also we have a lot of chronic returning patients, including those who leave Ukraine and then now temporarily living abroad. They are reaching us via telemedicine because they have some troubles with local healthcare system. It's heavy to adopt to their requirements and the insurance, etc. And they're trying to see to find their solutions in Ukraine.
Yeah, I think this definitely would need some investigation, and we'll come to that shortly. But you've identified several factors. I personally was involved with the Institute of Medicine looking at what was called the Gulf War syndrome, which was when soldiers came back developing IBS and dyspepsia. And one of the two main factors which led to the understanding of post-infection was enteric infection and the stress of war deployment. And I can assure you that was far less in its magnitude than what you're experiencing now. So it wouldn't surprise me. And then with your expertise in environmental and dietary factors, you're bringing in the component of nutrition and diet as well. So it's multi-component, it's significant. And as I said, it does require treatment. In your opinion, are there opportunities to help better treat the patients in Ukraine?
Yeah, I think so. I would try to briefly outline some probable possibilities. In my opinion, the first is to improve the level of knowledge of physicians in certain areas of managing patients with DGBI. For instance, improving communication skills. This is very important, and we have some gaps in knowledge obtained in medical school. I guess assessing the impact of nutrition and providing dietary advice, the second opportunity. Psychosocial assessment and treatment, and also using telemedicine, as we said before, and messengers in supporting of our patients. And I think also the pharmaceutical therapy, we have some shortage of them, of pharmaceuticals, because of secretagogues are not registered in Ukraine yet. But prucalopride, for example, the registration was expired and not prolonged because of the high costs of prucalopride. And also we have the serious trouble with financing. We have medical guarantee program by government, but it covers a very small part of costs of the cost of the patient. Thereof, they need to pay out of pocket money for all expensive drugs like rifaximin. No, this is also a big issue, and we're trying to change this situation by interaction with Ministry of Health and National Health Service. but it's not easy.
Yeah, also to let the audience know, our Oleg and our engagement has led to, I think, some hopeful value, because we've been sending you and your society the Rome 4 books for knowledge of DGBI, the gut feelings books.
Yep.
We can also send videos. I think we've sent you some access to the videos. I hope that they're being used and valued, and we'll continue to do that as you need.
Yeah, we use it from like since spring of 2022.
Yeah.
When you immediately responded to our appeal and provided the ground rounds. We
Yeah.
held several very, very successful meetings with large coverage of primary care physicians, gastroenterologists, and we received very positive feedback. Thank you.
I guess that relates to the next question. Is there ways to expand the choice of tools in the professional activities, for those managing DGBI, or have we covered all that? Is there anything else you want to mention?
Yeah, we got from you, from Tanya, the new videos, and we believe that they will help a lot to improve communication skills, to help for greater confidence of Ukrainian colleagues in planning and prescribing dietary interventions. And we also will seek the possibilities, and if such opportunities are found, to facilitate access of Ukrainian doctors to modern educational resources for gastropsychiatry, and for better using of telemedicine. This is like one of the key tools to improve the quality of care for DGBI patients.
Thank you. I guess maybe the last question is leading up to it. We need the science, we need the knowledge. I think there are pros and cons. The pros of doing study in Ukraine are quite obvious. It's a natural environment to understand the effects of war deployment and injury and illness on DGBI development. How realistic can the conduct of study be in this country, which is under martial law now?
Despite of all severe consequences of the war, the Ukrainian state is holding on and working. We have good telecommunications, internet, more or less the postal transportation services are working well in most of Ukraine. And I could say that our colleagues, scientists, educators, practitioners are very interested and motivated in conducting a national survey to study the features of DGBI in Ukraine during this active phase of the war. And now we are working to finish the draft of our vision for the study design, and we plan to present it for Professor Simran next week. We hope also that we will be able to provide full sample, both military and civilian patients. It will be more difficult with the former, but we have already preliminary negotiations with military colleagues and received consent to cooperate. So we are very optimistic as well for military, and we think this is possible.
What Dr. Shvets is talking about is the Rome Foundation Research Institute under the direction of Magnus Simran from Gothenburg, Sweden. We're going to be collaborating, and they'll be collaborating on doing a study to understand factors like the prevalence and factors that might make the condition worse. So any final words, anything you'd like to tell the audience?
I would like just to say thank you very much to you personally, to Rome Foundation, to all colleagues for supporting us, and we hope to to return to peace, just peace for Ukraine. It's very important for us to return to normal life, to work closely with Rome Foundation. I hope to see you in Kyiv.
That would be
Yeah.
nice.
Yeah, we could conduct the good meeting after war, after our victory, all together.
Well, thank you very much. And I hope we will see you in peace. Just as a note, my grandparents came from near Kyiv, and came to
I
the
know.
US.
Oh, yeah, yeah.
Tanya, anything else you would like to say?
No, just thank you both. This is just a very powerful message to us and helping educate other patients from around the world. So we really appreciate you being here today and wish you the best.
Thanks a lot, Tanya. Thank you.
Thank you.
Take care. Goodbye. See you.